episodes of wheezing after any short exertion of energy. So if he exercises, he has wheezing. If he walks for 200 meters, he has wheezing. If he exerts himself, he doesn't have angina. And he goes to see his doctor, and he's diagnosed with mild asthma. And what do we know about VB? VB is 18 years old, and his peak flow was at the time of diagnosis 420 liters per minute, which is 80% of the 525 predicted. And the doctor started him on salbutamol and the corticosteroid twice daily. What information do we have about VB and what can we do for him? To enable him to continue with his lifestyle of exercising and walking, we have to reduce the symptoms of asthma that he has. And how do we do this? We have to ensure that the drug therapy he's put on adequately reduces the symptoms and prevents more occurrence of this. Prevents any occurrence of this wheezing and shortness of breath. We also need to increase the peak flow volume to 90%. We also have to educate him on how to use his inhaler, which was given, the salbutamol inhaler, to ensure that he has optimal usage and prevention. Can you hear me from the back? Oh, very sorry. Come to the front. So, what we noticed from this case is that there is a critical omission of certain factors. We don't have a family history. We don't have any comorbidities. We don't have any factual data from objective assessment. So there is no spirometry data. We don't have any FEV or FPC. Basically, there's no experimentation or test carried out on him apart from the peak flow, which is not objective enough to make a proper diagnosis. But it is considerably it is significant to assume that he has mild asthma, according to the GINA 2023 guidelines. So the primary assessment that we have reached for BD is that he has exercise-induced bronchoconstriction, and the therapy is put on the short-acting beta adrenergic blocker will help in bronchodilation, which will actually help him during his exercises. But according to the GINA guideline, it should not be placed on this short-acting drug for a very long time because it is known to cause more exacerbations in future. The short-acting beta blocker is initially was thought to be very effective when asthma was thought to be just the disease of the constriction of the bronchioles. But now we know that it's more about inflammation caused by immune cells, immune cells, which is where the corticosteroid comes in and is very effective. According to the GINA 2023 guideline, also, you should start with the in, inhaled corticosteroid, at least 100 milligrams to 200 milligrams to 400 milligrams per day. But the dose we have here is 50, 100 milligrams per day, which can be considered subtherapeutic. And as such, one of the things we can do to help him with our therapeutic plan is to increase the dosage of this. So, as I stated earlier, what they missed in the original diagnosis is that there was no mention of prior treatment of asthma. So, we cannot uh, say more about the drugs they gave him or add any other drugs with him. What we can do now is to monitor the progression of the asthma with the current treatment and interventions that we have already suggested. That is increasing the dose and making sure he uses his inhaler appropriately and when he needs to. This will help him maintain his lifestyle of exercise and movement. question we have to answer is the social impact of asthma on his lifestyle. So I will allow my partner to take that part.
Good morning, all.
Morning, sir.
Okay. As my colleague has said, my cluster will be focusing on the social impact of asthma on breathing. One of the impact of asthma is that it would affect his breathing. And in order for us to do or help Vidi, we have to advise him to cut short his exercise and fitness. Since we found out that after exercising, he collapsed. So after walking for 200 meters, he experienced wheezing. So we have to help him know that his exercise and fitness should be reduced to the barest minimum so that it will not affect his asthmatic condition. Then secondly, we also have to talk about his mental health. When, as you all know, an asthmatic patient, when he or she experiences asthma, it affects his breathing. And so many become anxious in public areas. So we have to counsel Vidi on how he can be, or how fear or embarrassment, you should not allow fear or embarrassment to affect him, because this condition, as you know, affects his breathing. So we should counsel him so that he does not feel embarrassed when he is in the midst of others and this situation comes up. And that is where proper use of his inhaled meter dose inhaler should be encouraged. He should know how and when to use his meter dose inhaler. And also,
Time up.